Hi and welcome to leg stretching. And while we're gonna stretching our legs, I'm trying to read and study the Wikipedia article to the locked-in syndrome. Participating in the exercises is at your own risk, and the locked-in syndrome is a severe medical condition. So, to the first stretch. So, we are kneeling on one leg and the other leg comes in front with the toes up, and now we're pulling the toes towards us. So this is the basic stretch. And now we're gonna contract the quads for a few seconds while we're keeping with stretch. And releasing the contraction again. Now we're going to repeat it. So contract again and keep stretching. Locked-in syndrome, LIS, also known as pseudocoma, is the condition, and release again. Verbally due is a condition in which a patient is aware but cannot move or communicate verbally due to complete paralysis of nearly all voluntary muscles in the body except for vertical eye movements and blinking, and contract again and stretch. So someone with locked-in syndrome is paralyzed and they can only move vertical eye movement, they can only make vertical eye movements and blink. Locked-in syndrome. And release the contraction again, and we're going to do it for one round more. This is due to quadriplegia and bulbar palsy. The individual is conscious and sufficiently intact cognitively to be able to communicate with eye movements, and we're contracting again the quads and stretching. So the patient is conscious, so they are aware and they can maybe communicate with eye movements. And now with the other leg in front. Toes up, and we're putting the toes towards us and we're stretching the leg. And now we're contracting the quads. And releasing the quads again. Electroencephalography results are normal in locked-in syndrome, as these individuals have retained brain activity such as sleep-wake cycles and attention that is detectable. And contract the quads again and stretch. So tests with an electroencephalograph result in the same results as with people without locked-in syndrome, and contract again. So they show the same brain activity. The sleep-wake cycle is there and attention is also detectable. And release the quads again. And soon for the last time. Plum and Jerome B. Posner coined the term for this disorder in 1966. So Plum and Jerome Posner coined the name locked-in syndrome in 1966, and contract for the last time. And we're done with the first leg stretch. Now the leg to the outside. The toes are pointing forward. Now we're going to lift the foot off the ground and driving it into the floor. So going like this and we're pressing a bit into the floor. Locked-in syndrome can be separated into different subcategories based on symptom severity. This consists of classic locked-in syndrome, characterized by the inability to move distal limbs and facial muscles, but retained ability to blink and move eyes vertically with preserved cognition and consciousness. And release again and stretch a bit. So classic locked-in is the inability to move limbs and facial muscles, but we retain the ability to blink and move the eyes vertically. And again, driving the leg into the ground. And they have cognition and consciousness. Incomplete locked-in syndrome is less severe as classic locked-in syndrome and shares similar preserved abilities as classic locked-in syndrome, but has the hallmark of additional motor abilities and release with stretch, whether that be in the muscles innervating the lumps or face. And we're switching the leg. And the other leg with the toes on the ground, and now we're driving the leg again into the ground. We're pressing into the floor of it. And inwards, so in that direction. Incomplete is less severe. So there are some more motor abilities, whether it be in the muscle innervating the limbs or face. So we can move more muscles of limbs or face. And release with stretch a bit. Complete locked-in syndrome contains the conserved cognition and consciousness as classic locked-in syndrome, and again drive the leg again into the floor. but has additional motor deficits that render the individual unable to move their eyes vertically or blink. So incomplete is when even the eyes are not intentionally directable anymore. Locked in plus is an additional form and release restriction, distinguishing by impairments to cognition and consciousness, but contains damage to similar regions of the brainstem affected by other forms, notably the pons, with the addition of other cortical and subcortical regions. Now again the leg to the outside, and now we're going to turn it up with a flex spot, and in, and up, and in. So locked in, there is, beside the other paralyzings, the consciousness also affected, and notably affected are by this locked-in syndrome the pons, a region of the brain, and the cortical and subcortical regions. A few more. Signs and symptoms. Locked-in syndrome is usually characterized by loss of limb function and the inability to speak, and otherwise cognitively intact individuals. And we're done with that leg. Now with the other leg. Out with torso pointing forward, flexing the foot and bringing it up, and again in. So they can't speak. Those with a locked-in syndrome may be able to communicate with others through coded messages by blinking or moving their eyes. So they can vertically move their eyes by classical locked-in syndrome, and that can be a code and mean something. For example, a yes or no or something. Which are often not affected by the paralyzed, so the eyes are often not affected by classical. By complete, the eyes are also affected. Patients who have locked-in syndrome are conscious and aware, with no loss of cognitive function. And a few more. So someone who has locked-in or classical locked-in is aware, is by consciousness, and they don't have loss of cognitive function, so they can think normally. If it's classical, if it's complete, if it's locked in plus, then there are also effects on the consciousness. And we're done with that leg. And now we're going into the 90-90 position. So both legs like this, 90 degrees and 90 degrees. And we're going with our hands to the knee of a leg which is behind us. Now we're going to lean forward to the other leg, with the shoulder first. They can sometimes retain proprioceptions and sensation throughout their bodies. Some patients may have the ability to move certain facial muscles, and most often some or all of the extraocular muscles. Individuals with the syndrome lack coordination between breathing and voice. This prevents them from producing voluntary sounds with the vocal cords themselves, while the vocal cords themselves might not be paralyzed. So some patients may have the ability to move some muscles by incomplete, maybe even by classical, however, maybe there's no real distinction. And the coordination between breathing and the voice is disrupted, and therefore they cannot speak, even if it is the case that the vocal cords are not affected by the locked-in syndrome. Now again on the other leg. Again 90-90, and hands to the knee which is behind us, and we're leaning with the shoulder first forward. Individuals with locked-in syndrome also have intact hearing and subsequent language comprehension. So they can hear normally, and they can understand language. Their cognitive abilities are not affected. However, these patients might have trouble with voluntary breathing and require assistance due to apnea, ataxia, and hypopnea. So they can have problems with breathing. This can be coupled with dizziness and vertigo. So they can then get dizziness and vertigo because they can't breathe properly. Locked-in syndrome patients also have been reported to have involuntary movements such as sucking, chewing, swallowing, yawning, and moaning due to lost pyramidal control of motor systems. And we are switching into the other 90-90 position again. And now you're going to lean forward to that leg and are stretching that leg. Causes. Unlike persistent vegetative state, in which the upper portions of the brain are damaged and the lower portions are spared, locked-in syndrome is essentially the opposite. So not some other parts are, like the spine, is damaged, but at the brain itself, I guess that's what it means. I'm going to read it again. Unlike persistent vegetative state in which the upper portions of the brain are damaged and the lower portions are spared, locked-in syndrome is essentially the opposite. Now he's just said that the upper parts are not so much damaged, but the lower portions are damaged. Caused by damage to specific portions of the lower brain and brain stem. So the brain stem there is, and the lower brain bears the damage. And that is why the damage is mostly at the lower part of the brain, or the upper part. And if you like to, you can go now into the pigeon pose, if you can do it without injuring yourself. Now it looks by everyone differently, so it can be that your lower part leg is here, or that your hip is on the ground, or whatever, but that would be the pigeon pose. You can stay into the upper stretch, or don't make anything at all. The most important thing is that you don't injure yourself. With no damage to the upper brain. So the damage is at the brain stem and the lower brain. Injuries to the pons are the most common cause of locked-in syndrome. So the pons are damaged and that causes the locked-in syndrome. Possible causes of locked-in syndrome include poisoning cases, more frequently from a clade bite and other neurotoxic venoms, as they can usually cross the blood-brain barrier. So poisoning is one reason for this damage to the pons, which leads to the locked-in syndrome. Then brainstem stroke, so a brainstem stroke. Diseases of a circulatory system, so a disease at the circulatory system. Medication overdose, so wrong and too much medication. Drug overdose, so the use of drugs, and here's as example mentioned cocaine. Damage to nerve cells, particular destruction of the myelin sheath caused by disease or osmotic demyelination syndrome, formerly designated central protein myelinosis, secondary to excessively rapid correction of hypernatremia, and a stroke or brain hemorrhage, usually of a basilar artery. Now you can do that as long as you want to, so this could be very much long enough for you. It's all at your own responsibility this year. A stroke or brain hemorrhage. So a stroke is not just a brainstem stroke, but also a stroke or a brain hemorrhage, usually of a basilar artery. Then also a traumatic brain injury results from lesion of a brainstem and trauma. Curare poisoning and paralytic shellfish poisoning mimic a total locked-in syndrome by causing paralysis of all voluntarily controlled skeletal muscles. Respiratory muscles are also paralyzed, but the victim can be kept alive by artificial respiration. And now we're going to do that on the other side. So first into 90-90 position. And we're leaning forward. Diagnosis. Locked-in syndrome can be difficult to diagnose. In a 2002 survey of 44 people with LIS, so locked-in syndrome, it took almost 3 months to recognize and diagnose the condition after it had begun. However, it has reported that it can take upwards of 4 years to receive the diagnosis. Locked-in syndrome may mimic a loss of consciousness in patients, or in the case that respiratory control is lost, may even resemble death. People are also unable to educate standard motor responses such as withdrawal from pain. And if you like to, you can go into the pigeon pose if you can do it without to injure yourself. As a result, testing often requires making requests of a patient such as blinking or vertical eye movement. Brain imaging may provide additional indicators of locked-in syndrome, as brain imaging provides clues as to whether or not brain function has been lost. Additionally, an EEG can allow the observation of sleep-wake patterns, indicating that the patient is not unconscious but simply unable to move. So with an EEG, it can be tested if the sleep and wake pattern are normal and that the patient is conscious but just unable to move. And now I don't have much time left. And adding the pigeon stretch, and we're going on to the butterfly. just relax the way outside and try to only lean a bit forward. But this is the end. I don't have time yet. I thank you very much, and until next time.